Welcome back, viewers, to our latest episode of Across the Pond podcast, or the Pondcast, with Martin Cullip and I, Lindsey Stroud, at the Taxpayers Protection Alliance Consumer Center. Today, we've got a very special guest, another female in tobacco harm reduction, Dr. Marewa Glover. She's director of the Center of Research Excellence, Indigenous Sovereignty and Smoking, which is based in Auckland, New Zealand. She's a behavioral scientist that has more than 100 scientific publications under her belt, and she's been conducting research for over 30 years on reducing smoking tobacco-related harm. And recently, she authored a study of New Zealand adults that was and their understanding of novel tobacco endgame policies, which we will discuss a little bit more in this podcast. Dr. Glover, thank you for joining us.
Thank you, Lindsey and Martin. Thank you for inviting me to join you and have this discussion across the pond and across the ocean.
Across a couple oceans, actually. Yeah. Well, I know I gave kind of a brief introduction, but do you mind explaining to our viewers a little bit more about yourself, that, some people who, if it's possible, if they don't know who you are?
Well, I actually started in community health. That was just over 31 years ago. And then, so community health, I did my training mainly in psychology, then community psychology. Then I worked as a policy analyst for the Wellington, in Wellington for the government on public health. And that started me in public health. And I kind of got dragged into working on tobacco. So tobacco control for 31 years. I did health promotion after policy analysis, heading the first Māori National Tobacco Control Coordination Service. And then I went back and did my PhD. And from then I've been doing research and still doing research. Smoking cessation has been my main kind of area of expertise, but generally looking to reduce death and disease from smoking.
Yeah, and Lindsey, in our introduction, mentioned this new study that you've just published. It's discussing endgame strategies in New Zealand, because there's quite a number of them, aren't there? You've got you call it the sinking lid, the generational age band, whatever anyone wants to call it, which the UK has now taken up, of course, even though it's been dropped in New Zealand. But that wasn't even the main part of the endgame policies. It was things like reducing the nicotine in cigarettes, reducing the number of stores, and you were looking for how people understood these things. Could you tell us a bit more about it? What you studied and what the aims were?
Yes, so we have the Voices of the 5% study. New Zealand has a goal to reach 5% or below smoking prevalence by 2025, which is not that far away now. And this study we ran was following people who smoke, who didn't want to quit, or they didn't believe that they would be able to quit by 2025. And it's a long-term or longitudinal qualitative research study. So we interview people by phone, and in a qualitative method, we get really deep insights into what's happening for them and how they're feeling about all of the changes that were happening. And of course, then these endgame policies, well, they've been talked about for over a decade within tobacco control, but then they were proposed to the new Ardern-led government in New Zealand, and seemed to get a hearing, and then that government decided to pass them into law. So as you mentioned, there was what I call the denicotinization, so reducing the amount of nicotine in smoked tobacco products. And what was being talked about was 0.5 milligrams, and the yield would be 0.5 milligrams. That's very, very low, basically subfunctional, won't work, nobody's going to get a hit from it. When the law actually went through, they set that level at 0.8 milligrams, which is still really way below the trials that had noticed people stop noticing the nicotine below, I think it was 2 milligrams. So there was that one. Not only that, but because those low nicotine cigarettes have been around and been tried in various markets around the world for some time, but they've always failed at market, and they've always been available in a market where the usual strength cigarettes are. What was proposed in New Zealand, what was passed in New Zealand, was that only those cigarettes would be allowed to be sold. There would be no usual strength cigarettes available for sale for purchase in New Zealand. So that was really radical, had not been tried anywhere in the world. There was no research in a real life setting on what would happen if that was the case. So I thought that that's a real change in the way that policy was being done. Usually you would have research. There's a long period of consultation with stakeholders and the public, and that didn't happen. The other policy was to reduce the number of retailers who could sell cigarettes from 6,000, around 6,000 or more, across the whole of New Zealand. And people think New Zealand is small, but actually land-wise, we're about the same size as Japan. We're small population-wise, and that was radical, and again, an untested policy and very little research on what would happen. And the other one was the age ban, which now you are facing in the UK, Martin. And that is that nobody born after 1 January 2009 would ever be able to buy cigarettes. Now, in New Zealand, I don't know what it is in the UK, but in New Zealand, we have R18. So anyone over 18 is allowed to buy cigarettes or, and vaping products. What is it in the UK? Is it 18 or 21?
It's still 18 at the moment, yeah.
And it's only 21. It's only 21 in the states, but it's only at the federal level. Some of the states have not, the individual states haven't codified that.
Right. So again, this was a policy that it had previously been passed in a city in the Philippines, but it never got through a court challenge. And so another policy that had never been implemented anywhere in the world, no research on the potential consequences, positive or negative, and very little research to support a government passing that. So what happened was that the government was being presented with some surveys that were telling them that, about 78% of smokers agree with this and think it's a great idea. The surveys were, and many surveys and polls use a forced choice type of methodology where you're asked, do you agree, disagree on a scale of, 5, or sometimes it's yes or no. And I just thought, now hang on a minute. I don't know that this is a valid methodology when people can't possibly know, they don't know about these policies. They haven't been tried anywhere. So we decided to ask our participants in the Voices of the 5% study what they thought of these policies. And I really wanted to understand their cognitive process, how they thought through it. So I used the associative propositional evaluation model, and I kind of talk about, if you think about it like a filing cabinet. So when presented with a novel stimulus, something you've never seen before, often straight off, there's some kind of affective or emotional response. And then the second thing is people will go into the top drawer of the filing cabinet. What do I know about this? Nothing there. What's my experience of this? Nothing there either. Do I know anyone else who's tried it? No. And then they go down to another drawer in the filing cabinet, and they think about, well, what do I think about this? How does it fit with my values? And then they'll start talking about the potential positive and negative consequences which they're really imagining, and they try to associate it with other things like zero alcohol beer. And some of the participants said, I think it would probably be like smoking lawn clippings, or so there was some really interesting suggestions of what consequences might be. And there has been some research, the denicotinization research, where they had again, sort of crystal gazing, or this might happen or that might happen. But our participants, and we have, we've got over 40, and it's in-depth qualitative, so we're really getting really rich, nuanced information, and they had a lot more ideas about what might happen. So then they get to forming an opinion, and some of the participants, when measuring it against their values, they were like, well, I like the intent of the policy, to protect children from ever taking up smoking. Yeah, I support that. Some of them said, I can't possibly form an opinion on this. I just don't know enough. I'd have to talk to people who have experienced it. Why don't they do some research on it and give some people a denicotinized cigarette and a usual strength and see what happens? So some, really insightful comments, and then some others just hated it. They didn't like it. They were like, no, this is wrong. It's going to be another nail in the coffin for democracy. This is taking away adult rights, and, to choose what they put into their own body and autonomy. So there was a real range of responses. And these are responses, the range had not been discussed, I don't think, at a national or any level, even in the literature. So it was fascinating.
I think it's interesting, the research you're doing like that, because we know that we get fed polls all the time, don't we, when government wants to pass some sort of rule. And we've got the same over here at the moment. Action on Smoking and Health have been saying that a vast majority of the public support this generational age ban, because they say to them, do you agree with stopping children from ever being able to smoke? And people will say, well, yeah, we'd love it if children were never able to smoke. But then if you ask the same people, do you believe that when someone turns 18, they should be allowed to smoke if they so choose? They'll say, well, of course they should be allowed to smoke. So it depends what question is asked, isn't it? But it's good that you're getting deep into what the superficial understanding is, and also get them to talk about it a bit more and work out what the deeper feelings are.
Yeah, I mean, some of the negative consequences, especially in New Zealand, people expected that the black market would increase, that you're just handing it over to the gangs. And we have had quite a lot of robberies of tobacco stores. A storekeeper was killed. We have, bunches of youth ramming cars into the front of shops, even vape shops as well, and stealing product and selling it on Facebook. So, there's quite a lively black market in New Zealand, even though we're an island in the middle of the Pacific. And I think this is one of the reasons they thought it would work, and why New Zealand would be a great petri dish to experiment on and do this, so the world can find out what will happen. But there are people living here, and they're going to be affected by that. And I've always done research on how is this going to impact on lower socioeconomic people, obviously Māori, the Indigenous people of New Zealand, who have had much higher smoking rates since I've been doing this work, and people with mental health conditions. I mean, for example, with the denicotinization, it was just going to be 1 April next year. That would be it. The only cigarettes you could buy would be these cigarettes that are basically duds. And so what's going to happen for people with mental health conditions who, I mean, sure, you could think, well, people will stock up, but people who are on a low income can't even afford to buy the pouches of tobacco here, the loose tobacco. I think a 30 milligram is up to $75. And one of our participants, Bob, he can't scrape together $75. So he has to buy a packet of 20 cigarettes. Then he sits at night and he rips them apart to get the tobacco out so that he can roll his skinny little racehorse cigarettes and make it go further. So there's kind of I feel for their dignity, that people are picking up cigarette butts out of the gutter or off someone else's veranda out of their ashtray. And And I don't think that they should be made to do that. I think that I would rather see more harm reduction policies, humanistic policies that respect people and give people information, give them support, and give them access to risk-reduced alternatives.
So you mentioned earlier, and that your participants are the 5% that are not going, that, you know, will not quit smoking. Can you talk, because I think that in all of these conversations across every country that we're so focused on youth that we are forgetting that there is this population of adults that, regardless of what policies that have been going on in the past 20 years, are just refusing, are unable or unwilling to quit smoking. And why is it that I guess among your participants, like what was the reason, you know, the reasoning behind that? And I guess, you know, in your opinion, what should our policies be to kind of, instead of pushing this quit or die model that seems to be failing?
I think one of the different things about our Voices of the 5% participants as well is that we have a range from 19 through to, at recruitment, 81. So we have some older people, and older people are often left out of surveys and studies in tobacco control. So one man bled, and by the way, all of the case stories are going up on the website as fast as we can get them up there. And bled is one of our older gentlemen, and he's smoked, you know, pretty much his whole life, apart from when he was a little kid. And he likes his smoking. He grows his own as well. So he'll smoke his own, and then there's you know, once a month, I think it is, or I can't remember how often he goes to play golf, he'll buy a packet of cigarettes as a treat for himself. He has no intention of giving up. He enjoys it. He's healthy. He goes fishing. He's got a 50-year-old girlfriend he likes to tell us about and what they're getting up to. And, you know, he likes it just like that. And there are, you know, we got quite a few older people ring up when they saw the ad, and we'd pick up the phone and they just started, you know, going, you know, I want to tell you about what it's like. And they talked about the stigma they experience. One woman who's living like in a rest home type arrangement and had her own, you know, house in there. And she would sit out on her balcony and have a cigarette. There was another man who would make sure he would ride on his bicycle down to the river. He said, I make sure nobody can see me. You know, I never smoke around anybody. And it's just the real life experience of people who have smoked their whole life, contributed to society. You know, one man said, you know, I've always worked hard. I've paid my taxes. I would give to charities, which I won't do anymore, he said. And, you know, he talked about younger people seeing him on the street having a smoke and just looking him up and down with disgust and no respect. You know, they was feeling there was no respect for them as older people and the contribution they'd made to society. That's quite a relevant topic for today. It's Anzac Day here, celebrating all of our older people, most of them who have passed on now, who fought in wars for Australia and New Zealand. That kind of respect doesn't exist for many older people who smoke in New Zealand. And there's so many of them. However, we're 4 years in, and I'm now working on writing up the 4-year results. It has been amazing how many have shifted to vaping. And they started off like, nah, I don't like it. I'd never do that, or they didn't understand it. And I can't actually tell you how many, but I've just had all the interviewers saying they've quit, they've switched to vaping. So it's going to be exciting to look and see, you know, just how many have transitioned. And Bob, I was telling you about Bob, over the 4 years, he has transitioned from 5 skinnies, racehorses, he's down to 1. And, you know, for him, that's a big thing.
Yeah, it's overlooked I think deliberately by tobacco control, that no matter how much they say it's an addiction and it's not a choice. That came up regularly in the debate in the UK. You know, it's not a choice to smoke, it's an addiction. You're forced into it. When I hear people say, "Oh, nicotine's a useless drug, so you should just get rid of it." Well, you have obviously not smoked or vaped, because people who smoke often very much enjoy it. And being forced not to by taxation or whatever is a form of prohibition, isn't it? Despite the fact that tobacco control will always say, "Oh, no, no, we're not prohibiting, we're just encouraging or helping." But if you price people out of buying something that they enjoy, then you're causing them harm, aren't you?
Well, for some of our participants, it does cause harm. We have one younger guy who has mental health issues, conditions, and when we talked to him about it, we asked him about the denicotinization, and he was just like, I can't imagine what it would be like, or how I would, how I would get on with my day if I could not have that first cigarette. And he was really interesting because he's probably the first person who smokes who I've ever interviewed or really, had as a participant or even met in real life, who he can have like a hallucinogenic effect actually from nicotine, which is not unheard of in history. Like in Latin America, the shamans used it and would obtain that kind of a shift in consciousness and altered state. But I'd never heard a person in the Western world ever get that kind of effect. It really helped him. He's like been in jail for violent offences because of his mental health condition, and it really helps to calm him down, and I guess, like a self-medicating thing. So there are going to be some people for whom it will be a loss.
Yeah.
Yeah, and actually, my own father, he's what, 73. He had earlier this year, he had some issues, had a lung biopsy and stuff. And I talked to Dr. Pelosa when we were at COP10, because I was like, he's still smoking, and there is this thing too, when you've been smoking for so long, and then you just take that away from the people, it makes them so depressed that, Pelosa's comment to me was that he's like, I've lost more people when they quit smoking when they're at that age, because that was their one thing that kind of brought them joy. So I even had to tell my dad, I was like, you don't need to go sneaking it, Dad. I was like, just don't go smoke a whole pack of cigarettes a day, or we're going to be burying you next week. But, yeah, this quit or die. And I guess, yeah, you're right. It's a lack of compassion, especially for the older people. And we did see it at COP. The Secretariat did sit there at the end of COP10 this year, that it doesn't matter about the millions of adults who are smoking if just one kid gets addicted to these these less harmful products. And it's really, really a shame, unfortunately, on that. I do kind of have a question, kind of segue kind of back into New Zealand. Now that the UK is kind of crashing and burning as far as being our beacon of hope when it comes to tobacco harm reduction, all eyes are kind of on New Zealand. Can you talk more about what is going on with tobacco harm reduction there?
Yeah, so we had a new government in October last year, and so it's a centre-right government, and they had a long list of laws that they said they were going to repeal, and one of them was that smoke-free law with those three policies in it. I know they promised it, but I didn't think that they'd actually go through with it. I knew that they would get a lot of backlash from tobacco control and public health, but they did it. They did it. They repealed those three policies. They are gone. The denicotinization, the reduction of stores, and the age ban, all gone. The other thing is they have emphasized that they are still committed to smoke-free 2025 and the goal of 5% or below by 2025. And they said they're going to revoke a ban that the Ardern government brought in on oral nicotine pouches. So we had oral nicotine pouches along with vaping products being sold here from like 2015, before the regulation was brought in, the vaping regulation. In that vaping regulation, they banned the oral nicotine pouches. And I think that was a great shame. I think the more risk reduce and really very, very low risk alternatives to smoking need to be there to help people, give them something to switch to. And so it was a shame the oral nicotine pouches were banned. This new government said they're going to allow them to be sold. I don't think that has gone through yet because they're still in the process of repealing a lot of the previous government's legislation. And the other thing that they said they were going to do was, they're just going to, you know, keep funding smoking cessation services and campaigns to encourage people to switch to these risk-reduced products. And there's something else that they were going to do. But basically, I guess we could move a little bit more like Iceland, where people who smoke do have access to the 4 main risk-reduced products. But the other thing, the new government also said that they want to do evidence-based policy, and the 5%. We are at December 23, sorry, December 23, the daily smoking prevalence got down to 6.8%. So we're like right behind you, Sweden, you know, come on, we could get there. We really could get there. And that blew my mind. I mean, all 30 years, I never thought that even 5%, who knew what would be possible? I mean, Sweden has shown us, you know, that, yeah, pretty close to 5% is possible if people have access to vaping products and the heated tobacco products and oral nicotine pouches and snus. And sure, and so we could be 5% by 2025, what the new government said. So we don't need to do these policies, but we're going to get there anyway.
Yeah, I was quite astonished actually when how casually Jacinda Ardern dismissed nicotine pouches. I think what she said was, we just don't need nicotine pouches, or we don't need another nicotine product, and just ban them just like that. But like you said, we don't need another product. Well, you've still got people smoking. Of course you need another product, another option. So I'm really glad to hear that they're going to get rid of that ban on nicotine pouches, because, you know, the more options, the better, really.
Especially when there is so much misinformation put out about nicotine, so much anti-vaping rhetoric, you know, flooding the scientific literature, flooding the mainstream media. It never stops the lies that they come up with. You know, it's just, how could anyone even think of such a thing? Some of them are so outlandish, but it is scaring people off. And we see that with our participants. You know, yes, they've switched to vaping. It's a lot cheaper. You know, it is saving people a lot of money, but they still worry about, you know, these things they're being told in the media. So, yep, if you keep having that misinformation and disinformation, you know, absolute lies about vaping, then, yep, people are going to need another product to switch to. But now, of course, they're starting on the oral nicotine pouches and saying, you know, crazy, untrue things about the pouches.
Yeah.
Well, guys, we're getting into the last leg. As I told you, we don't keep everybody here super long. So do you have any final thoughts, especially seeing that you're, you know, behavioral scientist? Do you have some message to, you know, the medical professionals, researchers, scientists, especially the ones who seem to have this, you know, really strong apprehension to tobacco harm reduction policies or products?
You know, when I started, all of us were focused on reducing harm. It was about preventing people from developing smoking-related illnesses, which, you know, then many of them could go on to, you know, early death. So that should be the focus. That is what the mandate is for in public health. Public health shouldn't be being used to push this ideology or that ideology, political ideology or whatever ideology, but it really has been captured, I think, more by that kind of thing. And I think good doctors stay focused on their patient, the person before them, and what will work for that person. And so we have many good doctors in New Zealand who do encourage their patients who smoke to try vaping. We also have some who say, oh, no, you shouldn't touch that because that would be really bad for your lungs, you know, and so then the person just continues to smoke. So I think it's pragmatic and focused, person-centered, focus on what will work for them, whatever will work for them, support them to switch to it, whether it's oral nicotine pouches, combination, you know, because in New Zealand we also have patches, gum and lozenge subsidized by the government. People can get them free. So they've kind of dropped off, I think, a little bit. Vaping has really worked for so many more people than the patches and the gum ever did. But if someone's struggling on vaping, you know, maybe a combination of these products would work. Maybe a combination of oral nicotine pouches and vaping. Yeah, so I really wish it would get back to focusing on reduction of harm that has actually been proven, not made up.
Yeah, rather than a moral approach, stick to the public health approach, which I think many of them have forgotten. Well, I suppose reluctantly, the UK is handing the baton as global leaders on harm reduction to New Zealand. So congratulations on that. I think in the UK, they've with the regulations they're coming in, anti-vaping stuff, they've got no chance of smoke-free 2030, and with the tax on vapes, their commitment to public health is basically a sham, isn't it? So, but yeah, good luck to New Zealand, and thanks very much for joining us, Dr. Marewa, and I'm sure. I'm looking forward to more of your research on this cohort of people that you're studying in such depth. So thanks very much for joining us, and to everyone watching, thanks for watching another episode of the Across the Pond podcast with me and Lindsey, and we're back with another edition very soon. So goodbye from us.
Thank you, guys. Thanks very much.